Residency program has a very strong regulation system to make sure that we are training our specialists to international standards. So it's regulated both by the American ACGME and our local residency advisory committee. And it has a very well-defined curriculums with very clearly spelled out learning objective and core competencies. And the residents are given greater responsibility throughout the years of training, and you'll be undergoing regular formative assessment and examinations. And we also have dedicated faculty to make sure that the residents have closely supervised throughout their training.
The residency program puts in charge a program director who is really responsible for the running of the program, as well as the welfare and the educational processes that need to occur for this resident to learn.
The apprentice model works well when the numbers of trainees are small. But once the numbers of trainees are big, you find that the apprenticeship model is very much in a way a touch and go, because some people may have a good experience, others may in a way is left by chance. So to have a more structured training, Ministry of Health actually they did get a few countries to come over and to share the way they train, and they find that the US model is they think is the best suited if we actually want to have a more structured program.
NHG residency program actually offers 13 different specialties. So it is a graduate medical education program where residents can come and learn and specialize in various different fields in medicine.
Environment that will actually develop them to actually push the envelope, to be leaders in each of their fields when they actually become specialists. At the same time, we don't believe in training them in an environment where it's basically just a cold environment filled with all the professors everywhere.
As the largest sponsor institution, SingHealth Residency has 3 big hospitals. We also have 5 specialty centers and 9 polyclinics. So they offer big opportunities for training in terms of volume and variety of cases. We have the Center of Residence and Faculty Development, or CRAF in short, to train our residents to equip our residents with the 6 core competencies.
Residents could be very impressive in terms of their results, but just good results alone is not what we are actually looking for. We are actually looking for residents who actually can work together as a team, who are able to, in a way, portray. They, of course, it's a given that they must have integrity, and they must be able to show compassion to both the patients as well as their co-workers. At the same time, of course, they must believe in excellence, aiming for the excellence, because that's the only way that we can actually shape future medical leaders.
The main qualities that we look for in the NHG residency program is we know that medical students who have passed exams have the aptitude for further learning and for further growth. So we do not doubt the attitude of we do not doubt the aptitude of the residents. What we're looking for is the attitude that fits into the NHG culture.
We look out for potential residents with good integrity, self-motivated, hardworking, passionate about their job, and good team player.
I think what is important is that my advice is that don't rush, because it is sometimes difficult to decide when you are still a student, when you haven't really encountered that much of a working experience. Some of them may not actually know what specialty they actually want to go into, and my advice is don't rush. But of course, for those who have already know what they actually want, then my advice is that probably it is actually good to have some sort of a elective experience to mimic as much as possible what the working life of that particular discipline is like.
During the medical school, you should try to do, during a rotation, develop a passion for certain specialties and try to do an elective posting with a specialty. So at the end of the elective posting, you should do a self-reflection to see whether you really have the passion for the job. At the end of the posting, you also have a chance to get feedback from your core faculties or the program directors, whether you have the attitude and aptitude for the job. And if you completed a medical school, still haven't developed any particular passion for any specialty, my advice to you is no hurry, do a transitional year posting or do a houseman posting or medical rotations after that. And as soon as you have developed any particular passion, then you apply for the job. On top of that, if you're still not sure what you want to do, you are welcome to come to Sing Health Open House, whereby you have a chance to talk to all our program directors and look at the various programs to see what is suitable for you.
First of all, a young potential resident needs to be clear about what he stands for, about what are your values in working as a doctor. What is it that motivates you and drives you? Because ultimately, I think that is what's going to influence the decisions that you make, be it in a residency program or not in a residency program. Ultimately, that would be the main reason for you to choose the area of work that you're interested in. The second thing would then be that once you're clear about why you're doing this, is to be able to focus on which area of work that you're interested in. Remembering always that you still have to fall back onto the why. What is the purpose of further education and residency education? Ultimately, I hope, of course, that the answer to the why is patient care. And ultimately, I hope that through the course of our residency program, we are able to help young residents fulfill the potential and help them achieve these goals that they want for themselves.